If you had prostate surgery and still leak when you cough, stand, or even laugh, this video is for you. I'm gonna explain why that happens and what you can do to fix it. I was at church the other day and thought about how many older men were leaving to go to the bathroom in and out of the middle of the service. So many men left the service to go to the bathroom and they came back to church. And this is very prevalent. 1/8 of men get prostate cancer. And this can affect your ability to pee. When the prostate is removed, usually because of prostate cancer, your bladder control muscles are affected. You actually have two valves that help keep urine in. Think of them like two sink valves. The first one is the internal urinary sphincter. It's made of smooth muscle. You can't control it. The second one is the external urinary sphincter. And this one you can control. It's skeletal muscle, just like your biceps. And before surgery, most men rely on the internal urinary sphincter. The external urinary sphincter is basically on vacation and asleep. After surgery, the internal sphincter gets damaged or removed. So now we have to really focus on the external sphincter and it does all the work. But it's been asleep for many years and we need to wake it up. That's why many men leak after surgery, especially when they cough, move, or stand up fast. What kind of leaking happens after a prostate removal surgery? This type of leakage is called stress incontinence, and it happens when pressure builds up in your belly or your abdomen, like during coughing, sneezing, lifting, or laughing. And some men also feel a sudden urge to go to the bathroom and they can't hold it. That's urge incontinence, and sometimes they both happen together. Now here's the fix, pelvic floor training. And here's some good news, you can retrain these muscles. The main treatment is pelvic floor muscle training or Kegels, but they have to be done correctly. A pelvic floor physical therapist can help you find the right muscles, avoid using your stomach or glutes too much, build strength and endurance over time. Sometimes we use devices like biofeedback or ultrasound so you can see the muscles working on a screen. This helps you learn much faster. And research shows that supervised training works better than doing it on your own. Men who start before and after surgery get dry faster and feel more confident. Here are some extra tips to help your bladder. You can cut back on caffeine and alcohol as they're bladder irritants. You can spread out drinking your fluids throughout the day and practice bladder control techniques. If you still leak months later, your doctor might suggest other options like a male sling or an artificial urinary sphincter. But therapy is always step one, as the side effects are close to nothing. In conclusion, leaking after prostate surgery is very common and it's not your fault. It happens when your main sink valve is gone and your backup one needs to get stronger again. With the right training and a little patience, most men get back to full control. If you found this video helpful, hit like, subscribe, and join our free prostate surgery community in Facebook in the description. I'm Dr. Jonas, and I'll see you in the next one.